All right, so now it's time to talk thyroid, okay? I have about 12 slides we'll go through, and then we'll open up for questions, as Susan said. First, let's go over the prevalence of hypothyroidism. If you diagnose it just by labs, it's about 5% of the U.S. population. However, if you diagnose it via symptoms or basal body temperature, it can be up to 40%. And the reason being is that mild cases may be undetected with blood work. It's more common in females than males. Everybody can see that? Well, it's an 8-to-2 female to male ratio, so it does exist in males, but obviously it's much more common in females. Now, look at the host of symptoms here for hypothyroidism. Depression and fatigue are usually the first signs of hypothyroidism, underactive thyroid. Okay? Weight gain, cold sensitivity, high cholesterol, high triglycerides, high blood pressure, swelling. Let me just say that thyroid hormone is needed for every cell in the body. Okay? So as a result, an underactive thyroid could manifest in a myriad of ways, from the psychological system, depression, fatigue, to the cardiovascular system, high cholesterol, blood pressure, high triglycerides, the endocrine system. You can have menstrual abnormalities, dry skin, hair loss, brittle nails, muscle weakness. It can affect the GI system, constipation. It can cause impaired kidney function and shortness of breath. Just yesterday, I'll give you a little vignette. Just yesterday I had a woman come to see me, and she sat down in my office to the right there, and she started crying, and the first thing out of her mouth was, "I feel so depressed, I'm fatigued, and I can't lose weight." And I thought to myself, did she just say that because she saw my banner outside saying about thyroid, and she Googled like thyroid symptoms, because she was textbook case. And so this is happening very often, and it's really important we pick it up and treat it. I feel fully treated. Okay. And she was 30 years old, so I knew it wasn't menopause. Right? She's only 30 years old. Let's talk about the causes of hypothyroidism. The most common global cause is iodine deficiency. Okay, so in the world, that's the most common cause. But I think it was 1942 when the government started putting iodine in salt. Then it's become much less the cause of hypothyroidism in this country, although it still needs to be looked at. Hashimoto's disease is actually now the most common cause in the U.S., and we'll go into that. If you have thyroid surgery, if someone removes your thyroid, of course you'll have an underactive thyroid, or if it gets ablated, that'll destroy the function as well. Postpartum thyroiditis or hypothyroidism, it's about 5 to 10% of the cases, and it's transient. It'll go away within a year usually. Let's talk about Hashimoto's disease. I don't know, maybe some of you have that here. Likely, because it's the most common cause of hypothyroidism in the U.S. Antibodies bind to the thyroid gland and impair thyroid hormone production. Okay? We have a very good blood test for this. It's called the TPO antibody, thyroid peroxidase antibody. It's 95% sensitive. Okay, so this is a good test. It's an easy blood test. You can also diagnose it with ultrasound or fine needle aspiration. What are the causes of Hashimoto's disease? It's usually genetic, so there's a genetic predisposition. Also, environmental toxins can trigger this. So what do I mean by that? Well, high mercury, lithium, if people are on lithium medication, BPA, which is in plastics, plasticizers, iodine. I know we need iodine to make thyroid hormone, but if you have an excess of iodine, that can trigger Hashimoto's disease. We need to touch on leaky gut theory. This is a whole lecture in and of itself, but I need to touch on it at least. So the theory is that someone has a predisposition genetically to Hashimoto's, which is an autoimmune thyroid disease. Okay, so genetically they inherit this predisposition. And then their intestinal lining, we're talking about the small intestine, is impaired, is permeable. So our small intestine, that's where we absorb most of our nutrients. However, if that barrier, if the lining isn't intact, foreign things can leak out into the circulatory system, and your body can react to that as a foreign object and mount an immune response. Okay? In Hashimoto's disease, the food allergy, or the protein that is in wheat, is similar to the thyroid gland. So what happens is your body attacks the wheat and attacks the thyroid gland. So that's the theory about leaky gut, and there's the triad there, what causes Hashimoto's in some predisposed individuals. Okay, now we're getting into the fun part. Laboratory evaluation. I'll explain to you the labs I do. I do a TSH, a free T4, free T3, and thyroid antibodies. Sometimes I even do a reverse T3, but I left that out. But anyway, I'm going to explain why on the next slide, why these levels are important so it doesn't get missed. So the diagnosis of an underactive thyroid doesn't get missed. Usually, a TSH is done, and sometimes a free T4, but a lot of times the T3 isn't looked at, or the antibodies, and I really think it's important. I think it's a more comprehensive workup, and at that point it should foster a more comprehensive treatment plan, hopefully. Okay? Now, this slide, if you guys can memorize, it's also on your handout, so that's good. So, let me try to explain it. Okay, my lecture tonight is talking about primary hypothyroidism. That means the problem's here in the thyroid, okay? And that's 95% of hypothyroidism. It's due to a thyroid problem. That's the problem right there. But let me just explain the whole mechanism. So our brain, it's so magnificently designed that it stimulates the thyroid by thyroid stimulating hormone, TSH. And it tells the thyroid, pump out some thyroid hormone. So the thyroid does, if everything's working properly. It secretes T4, and the thyroid secretes a little bit of T3 because most of our T3 comes from T4. Okay? T4 converts to T3. Now, so T4 is a thyroid hormone, T3 is a thyroid hormone. I want to tell you, T3 is 4 to 8 times more important as far as cellular function. It's more active than T4. Okay? So, that's why in my previous slide, I really think T3 hormones need to be looked at. And let me just clarify things. When I say free T3 and free T4, that's the one that's not bound up by protein. That's the one we like. That's the one that our bodies use. So that's why we order those. Now, 2 important points on this slide. There's a negative feedback loop. Not to get too into this, but I want to help you guys interpret the TSH level, because I know all of you have had a TSH level, probably. There's an inverse relationship. If you have an underactive thyroid, your TSH is high. It's an and vice versa. If your thyroid is overactive, your TSH is low. All right, and this slide explains it. So if we have a lot of T3, T4 circulating around, it's a negative feedback loop. It'll tell the brain, stop producing it, I have enough, right? Okay? Now, if you have not enough T3, T4, this negative feedback loop isn't working to turn things off. So the brain tells the thyroid to produce more via TSH. Does that make sense? Mm-hmm. Okay, good. So that's the first thing I wanted to clarify, because some people come in here and say, oh, my TSH is really low, that means my thyroid's underactive, and I say no, it's reversed. Mm-hmm. Secondly, this is really critical tonight. This is the pearl I want you guys to take home. Okay, so remember how I said T4 converts to T3? Not in everyone. There are people called poor converters, okay? Mm-hmm. So there are people out there that are not converting their T4 to T3, and that's the most important one. And perhaps the labs you're getting are just TSH and T4. I don't know, but I used to practice in a place where that's all we checked. So that's why I can say that. So now the question is why? Well, why is this person a poor converter and this person not? I'll tell you two most common reasons. One is adrenal problems. And that's a whole different lecture. We'll do that next time. So if your adrenal glands aren't working properly, you're not going to convert to T3, which we really need. All of our cells love it. Okay, that's number one. Number two is if you have nutritional deficiencies, namely selenium, you're not going to convert. Okay? So that was the money slide. The treatment of hypothyroidism. So this is an integrated practice, so I like to integrate a lot of things, so which is good evidence for. So we're going to talk about diet, supplements, thyroid hormones, and exercise, okay? The diet. We need iodine to make thyroid hormone. So it's already in our salt, although a lot of us are using sea salt. So it'd be interesting to see over time if we have more hypothyroidism due to that. I don't know. Seafood has an abundance of iodine as well. However, we can't overdose iodine, because if we overdose iodine, then it can trigger in predisposed individuals genetically, it can trigger Hashimoto's. So I need to warn everyone. I had a woman come in here, new onset of hypothyroidism, and she wanted a natural approach. So she got sent to me from her primary, and I checked an iodine level, and her iodine level was over 8,000. It should be like we just wanted around 100, right? So it was over 8,000, and she was taking sea kelp drops because she read iodine was good for her. And it is, but if you overdose it, that's what threw her into, now she's Hashimoto's thyroid disease. So my approach is let's check levels and then let's supplement you if you need it, okay? So the other thing in your diet now, everybody pay attention, because I would never want to be the person telling you not to eat vegetables. That's not what I'm saying, but you have to limit certain raw vegetables. They're called goitrogens, okay? And in the raw form, for example, in the brassica family, like turnips, cabbage, rutabagas, mustard greens, radishes, in the raw form, if you cook them, you're okay. But in the raw form, they can interfere with thyroid hormone production, okay? Zinc is very good for thyroid, so here's some dietary things you can add. Seafood, beef, as long as it's grass-fed, organic beef. Oatmeal, chicken, liver, spinach, nuts and seeds are high in zinc. Copper, we find it in liver and other organ meats. Eggs, beans, nuts, and seeds. Selenium, because we're talking about selenium, yeah, especially with Hashimoto's disease, you should supplement with that. Brazil nuts, but I don't know who eats Brazil nuts, but they're high in selenium. And I have to tell you, I took this just so I don't copyright anything from this textbook. I'll put that for the record. The textbook of natural medicine. These are the supplements they recommend and the milligrams. So for zinc, of course, food first. If you could, incorporate more zinc in your diet, food first. Our body does best with food, but usually because of our schedules and because of sometimes the food sources, we're not getting all the nutrients. So zinc in supplemental form, 20 to 30 milligrams a day. Copper, 1 to 2.5 milligrams a day. Here's the selenium, 200 to 400 micrograms per day. Vitamin C, E. All these nutrients help support the thyroid. Like I said, selenium helps the conversion, right? Vitamin D. I put vitamin D up there. That wasn't on their list, but it's on my list because vitamin D is an immune modulator. Vitamin D is vital for our immune system. So if anyone has an autoimmune disease, it's really paramount that we check a vitamin D level and get that optimal. I don't want it 30 or 32. The range for vitamin D, if you look at the reference range on the lab slip, is 30 to 100. It's such a large range. We want optimal, which is like 50 and above. So if vitamin D comes back 31, it won't get flagged high, but really I'm telling you, that's not great. Especially if you have an autoimmune disease or cancer, you want that vitamin D up. So that's what I do. I check a level and I replace it as needed. Iodine, I already talked about iodine. How you check for iodine is a spot urine. Well, that's one way to do it. I do, which is now the standard, it's a spot urine iodine test. So with regular lab, if you're getting your blood work, and if it's on the lab slip, spot urinary iodine. You have to be fasting. And it used to be you had to collect a 24-hour urine, which is difficult for patients. But now that's the way to check it, okay? So it's a urinary iodine level. Just one spot urine, you don't have to do any more. So that's what I do. That's what I found in that woman, and it was over 8,000. So anyway, now let's talk about thyroid hormone replacement. There's synthetic treatment, which is levothyroxine, which is called Synthroid or Levoxyl, and that gives you T4. Okay, that gives you T4. There's also synthetic T3, liothyronine, which the brand name is Cytomel, which is T3. A natural treatment is natural desiccated thyroid. They get it from pig's thyroid. Those names are Armour Thyroid or Nature Thyroid. In that compound, in that medicine, you get both. You get T3 and T4 hormone. And I made a note here, take it on an empty stomach. It's really, really important for absorption. If you're taking it with food, your body's not absorbing it and utilizing it. And lastly, let's talk about exercise. Exercise, especially invigorating exercise, stimulates the thyroid gland and stimulates its function, especially water sports. However, it's recommended for an underactive thyroid to avoid overheated environments. So those of you who like hot yoga, if you have an underactive thyroid, it's probably not the best, and perhaps you might need an increase in your dose. It's just a thought regarding exercise.